Hello everyone, welcome to Public Health with Mara, where we talk about real life issues that affect our health and our communities in general, as well as our future. Today I want to start with a powerful question. Why do we treat people only for us to send them back to the conditions that made them sick in the first place? So before we unpack this together, if you're new here, thank you for joining, and kindly don't forget to subscribe, like, share and comment. I would like to engage with you. Also turn on your notification so that whenever I post new videos you get notified and watch it. Thank you so much. Let's dive right in. So the question I asked earlier, why do we treat people and only for us to send them back to the condition that made them sick in the first place? What does it actually mean? It means that treating someone that was sick without changing the condition in which caused the sickness is like putting a band-aid on a wound without treating it, without putting your the spirits and the GV. So it's a cycle of sickness, and it keeps on reoccurring and reoccurring unless we do something differently about it. So imagine a woman sick with typhoid. She goes to the hospital and then gets medication, feels better, and then goes home. But our home has no clean water. It has no functioning toilets. She still buys food from that dirty store by the roadside. So how long do you think before the woman will get sick again? How long do you think it will take before the woman gets sick again? This is the reality of many people out there, not just in Nigeria and Africa, but in so many low-income countries. So this is where public health comes in. While doctors and nurses focus on treating patients and taking care of them, public health focuses on preventing the illness from happening in the first place. We ask questions like, why are there so many mosquitoes in this area? Why don't people have access to clean water or clean hygiene? Why do markets operate in an unhygienic environment? We change these conditions to ensure that the environment is suitable for people to live in and to prevent illnesses from increasing, and to make sure that we all are living in a healthy environment. So imagine this. Think about this for a second. You treat a child for malaria, but there is still stagnant water everywhere. You deworm a child, but the child still goes back to play in an environment where there are bare open gutters everywhere. He plays barefoot on where there are open gutters. You treat someone that is suffering from respiratory infection, and then the person goes back to cook indoors in an environment where there are no windows, or uses firewood to cook indoors. Without changing the environment people live in, people will keep getting sick. So we have to work on our environment. We have to change the environment we live in for us to be able to live healthy. The truth is, the healthcare system in Nigeria, or the healthcare system in general, they are doing their best. They are focusing on treatment, but we have to go deep. We have to go to the upstream. We have to go to the root causes of these illnesses, and this is the social determinants of health. That is poverty. That is poor sanitation, lack of education, lack of awareness, lack of hygiene, housing. We have to work on these social determinants for us to be able to have conditions where everybody's living healthy. We are all living healthy. We need policies that would bring about changes in our social system. I know there are public practitioners and advocates watching this video, so you need to push for policies that would bring about changes in our social system, and not just focusing on treating symptoms. Because if you treat the symptom and they go back to that condition in which they were, they will still get back to being sick. But if you create a condition where they are living healthy, where the condition is there's clean water, there are good housing system, there's education and awareness, it's going to prevent people from getting back to being sick. We all will live healthy and live in a healthy environment. So if you watched my last video where I spoke about public health is you and I'll ask you this question: what can you do? What can you do now that you're enlightened? You need to speak up about You need to speak up in your community about clean and hygienic environment, clean water. You need to educate your friends, you need to educate your families and create awareness. You need to support policies that would improve the public health in general. And you need to keep watching this video like you're doing right now, so we can explore these issues and talk about it together. Let's not just treat illnesses. Let's stop it from happening. Let's stop it from occurring in the first place. Thank you so much for watching this video. And if you were enlightened, don't forget to like, share and subscribe. Drop a comment below. And the question I would like you to answer is, what do you think is the biggest challenge or causes of illnesses in your community? Please, I would like to hear your thoughts on this so we can discuss this further. So until next time, stay informed, stay healthy, and remember, public health is you and I. Thank you for watching.